This is Dr. Thomas Klein. I'm coming to you from Raleigh, North Carolina. Our special interest currently is people with chronic and rare painful diseases, currently being discontinued at the request of the CDC and PROP, which is the Physicians for Reduced Opioid Prescribing. And it's not true. Our video we just published shows that it's not true, that all their data is wrong, and we've been talking all along how all their premises are wrong, so everything is wrong. They should have never been in the business of deciding anything about the treatment of pain, and certainly not about prescription drugs. So it's time that the CDC and the PROP group disembark. We want their guidelines suspended, not revised. Until they're suspended, they stay in place. Harm is occurring every single day. And, oh, sorry. Good thing our cameraman's awake. Okay. So, part of the problem is about overdoses. They're giving out Narcan at $135 a piece to pain patients. We have no evidence that anybody who goes to pain clinics or to pain management or is treated by physicians for their chronic pain has ever become addicted. Not a single case. We're going to be presenting one of these sessions claims that people become addicted, but they don't use the proper definition. Our definition is the definition we use for heroin disease, which is uncontrolled searching and seeking for substance without any regard for consequence. That's it. If a person fits that picture, then they have true opiate addiction disease. And if they do, they're subject to overdose. But the fear is that people on prescription drugs will overdose. So you give Narcan, but we've already discussed how Narcan it probably doesn't need to be needed, but there's something cheaper. And this is good for anybody who may overdose. And it's called an Ambu bag. I did not know until I looked this up on the internet, on Amazon, that Ambu is a registered trade name. But that's what we've always called it. It's kind of like Kleenex, you know? Kleenex is actually a trademark. So anyway, I don't represent these people. And you can go on the internet and look at your various stores, Amazon being a good one, and see if you can find these. Okay, here is one. This is an Ambu bag. You can keep somebody alive and breathe for them indefinitely because it doesn't work on batteries. It works with your hand. All right. This was $26. So here's the bag. You pull this out like this. And you pull this out like this. And there's your Ambu bag. And you see how it works? Carry it around too. That pumps air. And that springs back, right? Simple. Nothing to it. So they give you a little mask. And you put the mask on here. And that's where your nose goes. And so you could even do it yourself. Or you could do it to anybody else, you know? You just put it on their mouth, hold it down, mouth and nose, and you can breathe for them. Okay, this you can get out of the bag in about 4 seconds and save somebody's life while they're not breathing. A Narcan, you can fumble around. Where is it? Oh, how does it work? $131? This is the solution. This is what anesthesiologists use. Old doctors used to have one in their office. $26. Now, this is a tube for oxygen. You don't need that. You just get rid of it. Well, it's not going to get rid of easily. Anyway, you pull that off. You don't need it. And you don't need this bag on the back. So then you can just fold it up. Keep it wherever you need to keep it. Take the little mask off. Keep that somewhere clean. And there you have a way to resuscitate somebody who has quit breathing. So if you're really afraid that you're going to quit breathing because you're taking benzodiazepines and opiates, and you've been taking them for 15 years and nothing's ever happened, the government says, oh my God, it could happen at any time. And if you're afraid of that, $26, solve your problem. That's it for this evening, and I'll see you again.